What is endometriosis? Endometriosis, pronounced endometriosis, is a condition where tissue similar to the lining inside your uterus starts growing outside of it. This tissue often appears on the ovaries, fallopian tubes, and the lining of the pelvis, and in rare cases, beyond the pelvic area. The problem: this tissue behaves like normal uterine lining. It thickens, breaks down, and bleeds during your menstrual cycle, but because it's outside the uterus, it has nowhere to go. That trapped blood and tissue can cause inflammation, scar tissue, and painful adhesions that can make organs stick together. If it affects the ovary, cysts called endometriomas may also develop. The result: endometriosis can lead to significant pain and even fertility issues. But the good news: with the right treatment, it's possible to manage the symptoms and take control of your health. Common symptoms of endometriosis. The most noticeable symptom is pelvic pain, especially around your. But it's not just typical cramps. People with endometriosis often describe the pain as far more intense and long-lasting. Here are some key symptoms to look out for: painful periods, dysmenorrhea, cramping, and pelvic pain may begin before your period starts and last several days. You may also feel discomfort in your lower back or abdomen, pain during or after sex. This is a common symptom that can affect intimacy. Pain when using the bathroom, bowel movements, or urination may become painful, especially during your period. Heavy or irregular bleeding. You might notice heavier menstrual flow or spotting between periods. Difficulty getting pregnant. For many, infertility is the first clue something's wrong. And endometriosis is a common underlying cause. Other signs: fatigue, diarrhea, constipation, bloating, and nausea, especially during your period. It's important to note that the severity of your symptoms doesn't always match the extent of the condition. Some people have intense pain with only a small amount of endometrial growth, while others have widespread tissue with little or no discomfort. In fact, some people don't have any symptoms at all and only discover they have endometriosis when facing fertility challenges or undergoing surgery for another issue. Getting the right diagnosis: endometriosis can mimic other conditions like pelvic inflammatory disease, ovarian cysts, or irritable bowel syndrome (IBS), which can complicate diagnosis. IBS in particular shares many digestive symptoms and can even occur alongside endometriosis. That's why it's so important to talk to a healthcare provider if you're experiencing ongoing pelvic pain, irregular periods, or trouble. Conceiving early diagnosis and treatment can make a big difference. Take charge of your health. Living with endometriosis can be tough, but you're not alone. The earlier you get help, the better you can manage. Stay informed. Listen to your body and don't hesitate to seek support. Need help? Reach out to a healthcare professional today at +254 7011.